Wow, looks like someone's been doing their homework.
Uh-huh, yeah.
You sent us a ton of stuff on knee pain articles, excerpts, even some personal stories.
Someone's knee is talking to them, I think.
Right. Well, today we're diving into all of it to figure out, when a creaky knee is no big deal and when it's like, hey, get me to a doctor's stat.
Exactly.
So we're going to help you decode all those pops and clicks and groans, figure out what's normal, what's a warning, and what's a red flag, like head to the ER kind of red flag.
Right. And we're going to make sure you're ready to talk to a doctor, too. Give you the knowledge to ask the right questions.
Okay, so first off, the sources really stress this difference between warning signs and red flags.
Yeah. Yeah, it can be tricky.
It can be.
And it's super important to know the difference. A warning sign. Probably a good idea to call your doctor. A red flag. No time to wait. Got to get medical help. ASA.
Okay, like one of the articles said, if your knee looks like it's trying to bend the wrong way, like backwards,
Oh, yeah.
that's a big red flag.
Huge. You definitely don't want to be doing yoga if your knee looks like that. Probably means a dislocation or even a fracture. Both need immediate attention.
Okay, noted. So besides a knee doing party tricks it shouldn't, what other red flags should we watch for?
All the sources agree. Sudden swelling, especially if the area is warm. That's a big one.
Why is sudden swelling so scary?
Well, it can mean a few things, but one of the worst is an infection in the joint. You do not want to mess with that.
Makes sense. Got to catch those infections early. What about instability? That was another red flag the sources mentioned.
Yeah, instability. That's that wobbly, giving way feeling. Like your knee could buckle any second. Often means ligament damage, like an ACL tear. Super common in athletes, but can happen to anyone, especially if you twist your knee the wrong way.
Ah, so if your knee feels untrustworthy, get it checked out.
Exactly. And the third big red flag, can't bear weight.
Oof.
If you literally can't put any pressure on your leg without major pain, could be a fracture or something equally serious.
Okay, those all sound pretty intense. But what about those of us who just have, everyday knee pain? I know my knees get achy after a long run. How do we know when it's just normal wear and tear versus something we need to worry about?
That's where it gets tricky, right? But the sources offer some good advice. They talk a lot about functional limitations. It's not just about the pain, it's how that pain affects your life.
So if I can still walk the dog and climb stairs without my knee screaming at me, I'm probably okay.
Probably. But if you're struggling to do everyday stuff, or you're constantly, changing how you move to avoid pain, or if it's waking you up at night, those are all signs it's time to see a doctor.
It's that line, right, when it goes from annoying to actually messing with your life.
Yep, exactly. And sometimes the clues aren't as obvious. A few sources talked about things like unexplained weight loss, or even a fever along with knee pain.
Wait, really? That seems so random. How are those connected to your knee?
Yeah, it's interesting, right? It's like your body trying to tell you something's up, but in a roundabout way.
Yeah.
It might mean the problem isn't just in your knee, it's systemic.
Systemic.
Meaning it affects your whole body, not just one spot. Could be something like an autoimmune disorder. Those can sometimes cause joint pain, including in the knee.
So even if it seems weird, sudden fever, weight loss, plus knee pain could be a sign to check in with the doctor.
Exactly. Your body's trying to communicate. You got to listen.
This is more complicated than I thought. Okay, so we've got our red flags down. We know that how the pain impacts our life is a big clue, and even some random seeming symptoms could be connected. Is there anything else we need to know before we even think about calling the doctor?
Yeah, one more big thing that comes up again and again in the sources: early intervention.
I hear that phrase all the time, but why is catching knee problems early so important?
One of the studies you found actually found that people who got treatment for knee pain within a week were twice as likely to fully recover compared to people who waited a month.
Wow, okay, so don't wait till your knee sounds like a bowl of Rice Krispies.
Haha, exactly. The sooner you address it, the better the outcome in the long run.
Got it. Pay attention, know the signs, and don't wait.
Yeah.
Okay, but what about when we actually go to the doctor? How can we make sure we're ready for that conversation?
That's a great question, and that's exactly what we're going to tackle next. All right, so you've noticed some of those warning signs, maybe even a red flag or two.
Definitely time to see the doctor.
Yep. And the sources really highlight how important it is to be prepared for that appointment.
Makes sense.
Yeah.
I know I've totally blanked before. Like you get in there and forget everything you wanted to ask.
Yep. Happens to the best of us. So how do we make sure we have a good, productive talk with our doctor about this knee pain?
Well, what do we need to tell them?
You got to think like a detective, right?
Yeah.
You're trying to solve the case of the achy knee. So first things first, be ready to really describe the pain in detail.
More than just my knee hurts.
Way more. When did it start? What does it feel like? Sharp, dull, aching, burning. Does it come and go, or is it constant?
Okay, so details, details, details. Paint a picture for the doctor.
Exactly. And think about what makes it better or worse. Does walking make it flare up? Stairs? Kneeling? Does rest help? Ice?
So basically, become a knee pain expert on yourself.
You got it. And a few sources mention keeping a pain journal.
Oh, yeah, write it all down.
It can be super helpful. You track the patterns, give your doctor a good history of what's been going on. When the pain happens, how bad is it on a scale of 1 to 10? What were you doing when it started? All that stuff.
My grandma always used to say, pain is what the patient says it is. Even if it seems minor, if it's bothering you, it's worth getting checked out.
Love that. Pain is subjective. You got to advocate for yourself. Don't downplay it. Don't try to tough it out. If it hurts, tell your doctor.
And ask questions. One article really made that point. It's a conversation, not a one-way street.
Absolutely. Write down any questions you have ahead of time so you don't forget in the moment. Ask about possible causes of the pain treatment options. What to expect during recovery. It's your health. You deserve to be informed.
Okay, so we've got our detective notes, our pain journal, our list of questions. What happens when we actually get into the doctor's office?
Well, after talking about your symptoms and medical history, the doctor will probably want to examine your knee, check for swelling, tenderness, range of motion, any signs of instability.
Makes sense. Got to see what's going on in there.
Right. And depending on what they find, they might order some tests to figure out the root of the problem.
Like what kinds of tests?
X-rays are usually the first step.
Yeah.
Can show fractures, arthritis, any bone issues. But if they think it's a soft tissue injury, they might order an MRI.
Ah, right. An MRI can see things X-rays miss, like ligaments and tendons.
Yep, gives a more detailed picture. What about blood tests? Ever had those for knee pain?
Not that I remember.
They can be helpful to rule out certain conditions, like rheumatoid arthritis, which is an autoimmune thing, or an infection in the joint.
So basically, it's a puzzle, right? The doctor takes all the pieces, your description, the exam, the test results, and tries to figure out the cause.
You got it. Diagnosis first. Then they can create a treatment plan that fits your specific needs.
And speaking of treatment, the sources we sent talked about everything from just resting and icing to, like, surgery.
It's a lot, right? But let's break it down a bit. One thing you'll see mentioned a lot is rice therapy.
Rice, like the food.
Uh-huh. Not quite. It stands for rest, ice, compression, elevation.
Oh, right.
It's the go-to for acute knee injuries, like sprains or strains.
So if I, like, trip and twist my ankle, rice is the first thing I should do.
Well, for your knee, yes. Haha.
Oh, right. We're talking knees, duh. Okay, so rice calms things down right after an injury. What about long-term solutions? The sources really highlighted physical therapy.
PT is huge. It can help strengthen the muscles that support your knee, improve flexibility and range of motion, get you back to normal, basically.
Not just masking the pain, but actually fixing the problem.
Exactly. A good physical therapist will create a program just for you to help regain strength, flexibility, and stability. And they can show you exercises to do at home to keep your knees healthy in the long run. Okay, so PT is key. What about meds? Anything we can take for the pain?
For mild to moderate pain, over-the-counter stuff like ibuprofen or naproxen usually does the trick. But if those aren't cutting it, your doctor might prescribe something stronger, like corticosteroids, to reduce inflammation.
Some of the sources also talked about injections. What are those all about?
Yeah, there are a couple of types. Corticosteroid injections put anti-inflammatory meds right into the joint. Can be really helpful for arthritis, especially
what other kind?
hyaluronic acid injections. Hyaluronic acid is actually something your body makes naturally. It helps lubricate the joint. So these injections can help with mobility and pain. For osteoarthritis, mainly. Okay, so we've got RICE, PT, medications, injections. What about the big one, surgery? When is that necessary? Yeah, when does it get to that point?
Usually surgery is a last resort when nothing else has worked, or if there's major damage to the joint, like a torn ligament or a really bad cartilage issue.
So not the first option, but good to know it's there if needed.
Right. And surgery has come a long way. Lots of procedures are minimally invasive now, smaller incisions, faster recovery.
That's good to hear. It seems like there's so many different approaches to knee pain. It really depends on the cause and how bad it is.
Exactly. No one-size-fits-all solution.
So working with your doctor to figure out the best treatment for you is key.
Absolutely. And that brings us to another important point that a lot of the sources mentioned, prevention.
Oh, right. Now that we know how complicated knee pain can be, it makes sense to try and avoid it in the first place.
You got it. And thankfully, there are some great tips in these sources for keeping your knees happy and strong.
All right, so we've talked about what to do when the knee pain hits. But let's be real. Who wants to deal with that if we can avoid it?
Right. Prevention is key.
So let's talk about that. What can we actually do to keep our knees healthy?
Well, the sources all agree on one major thing. Maintaining a healthy weight makes a huge difference.
Yeah, makes sense. Less weight, less stress on the joints.
Exactly. Every extra pound puts more pressure on your
No,
knees.
that's like carrying around an extra suitcase everywhere.
Uh-huh, pretty much. And even losing a small amount can really help. Lower your risk of pain and osteoarthritis, even.
Okay, so watch the weight. What about exercise? Is there a best workout for knee health?
The sources all recommend low-impact activities, stuff that strengthens the muscles around the knee, without pounding on the joint itself too much.
So like swimming, cycling, just walking.
All good options. They build strength and endurance, but are gentle on those knees.
Okay, so low impact is good.
Yep,
But what about strength training? Isn't lifting weights bad for your joints?
that's a myth. Targeted strength training can actually be really good for your knees.
Really? How so?
It's all about building up those supporting muscles. The quads, hamstrings, calves, those guys help stabilize the knee and absorb shock.
So it's like giving your knees their own personal bodyguards.
Uh-huh, exactly. And proper form is key, of course. If you're new to strength training, find a good trainer to show you the ropes.
Right. Don't want to cause any new injuries while trying to prevent old ones. What about stretching? That seems important too.
Absolutely. Stretching helps keep those muscles flexible, which means a better range of motion and less risk of injury.
Makes sense. Tight muscles can pull on your joints and mess with your alignment.
Exactly. It's all about balance.
Okay, so weight, exercise, stretching. Oh, what about shoes? Can the right shoes actually help our knees?
You'd be surprised. Supportive shoes with good cushioning make a big difference.
So maybe ditch the flip-flops for running errands, huh?
Probably a good idea, yeah. Supportive shoes help absorb impact, especially when you're running or jumping.
And posture too, right? I feel like I slouch way too much.
Posture is huge. Bad posture puts extra strain on everything. Your knees, hips, back. Stand tall, engage your core, be mindful of how you're holding yourself.
So basically, treat your body with kindness.
Exactly. And even if you've already had knee issues, it's not too late to start incorporating these tips.
Never too late to show our knees some love.
Right. And remember, the more you know, the better equipped you are to make good decisions about your health.
Well, I think we've officially covered it all. From warning signs to doctor visits to treatment and prevention, this has been quite the knee journey.
It has. Hopefully our listeners are feeling more knowledgeable and empowered to take care of their knees.
I know I am. Now, if you'll excuse me, I'm going to go find my sneakers.
Haha, that's the spirit. A little proactive care goes a long way. And remember, if you ever have questions or concerns, talk to your doctor. They're your best resource for personalized advice.
That's right. Until next time, keep those knees happy and healthy and keep exploring the world.